Okay, so wobbler syndrome has I was going to say 5 grades, but if we include 0 it's 6, but 0 basically means normal examination with no deficits, so let's say 5. So scale of 0 to 5, so if that's the question, say 0 to 5, not 1 to 5. But yeah, grade 1 describes mild neurological defects, and of course can only be identified by a vet, it's not obvious. Grade 2, it can be detected by most horse owners. Number 3, the deficits are obvious and detected by anyone. Grade 4, horses may fall during the examination and return to standing without help. Grade 5, a horse is lying down and unable to get up, so that's quite horrible. So yeah, diagnosis, it obviously says x-rays, it's very helpful. And yeah, you can look at the vertebral malformation by 5 x-ray signs, so osteoarthritis, so inflammation of the joints, subluxation between adjacent vertebrae, so this means the vertebrae slide out of place. Just imagine they all sit on top of each other like that, so this is subluxation. Flare of the caudal physis of the vertebral body, so I imagine it's just like inflammation maybe, or breaking down. Abnormal ossification patterns and caudal extension of the dorsal laminae. So yeah, to determine if the vertebral canal diameter, sorry, it's a bit too far, and the okay, so you basically diagnose wobbler syndrome or cervical stenotic myelopathy objectively using the vertebral canal diameter by the sagittal ratio, SR, and the intervertebral ratio, and you can do a myelographic examination, so it's a definitive diagnosis of cervical stenotic myelopathy, and you see sites of spinal cord compression, and yeah, lesions that are static or dynamic. So yeah, this is a bit complicated, so I'll give it a go. So you have the sagittal ratio. You do this by dividing the minimum sagittal diameter of the vertebral canal. So this is A. So you divide this, the diameter of the vertebral canal. So this is the diameter of the vertebral canal, divided by the corresponding vertebral body next to it. And you can do this with several, let's say, vertebrae. And it says the minimum sagittal diameter is measured from the dorsal part of the vertebral body, so from the back to the ventral border of the dorsal laminae, on the cranial aspect of the vertebrae. Sorry. I just want to be clear. Anyway, so the SR should exceed, I'm going to show you the letters as well, 52% from C4 through C6, 56% at C7, weighing no more than, for a horse that weighs more than 320 kg. So for the intervertebral ratio, they're obtained by determining the minimum distance from the cranial dorsal aspect, so this would be here, of the vertebral body to the caudal aspect of the vertebral arch of the immediately following rostral vertebrae, so like C1. So this is determined by the height of the vertebral body, so that's B. So remember, A is vertebral canal, B is vertebral body nearby. That's it, basically. Yeah, so it shows you what a flare of the caudal epiphysis of the vertebral body of C3 looks like. And you also have caudal extension of the laminae of C3, and that's what the 3 arrows are showing. And you also have C3, C4 subluxation. Here you can see osteoarthritis of the articular processes. That's what the white arrows are showing. So you can see bone there that isn't supposed to be there, and inflammation. Yeah, and in this case, you can see the SR, what was it again? Sagittal ratio is more than 50%, less than 50%, sorry about that. Very confusing. And yeah, you can see compression and subluxation of C3 and C4, so they're popping out of place during ventroflexion. So what this means is bending of the neck. And yeah, this is what we call the myelographic examination. So yeah, wobbler syndrome is easy to confuse with basically all of these. So I'll just say them quickly: myeloencephalitis, myeloencephalopathy, equine herpes, and spinal cord trauma, of course. So yeah, this is the last slide, thank God, because I hate this. So yeah, you can treat this using glucocorticoids or even non-steroidal anti-inflammatories, and of course, just don't make them exercise, but not too much. And yeah, put them on a dietary program to restrict energy, because sometimes high carbs don't help, but allow a balance of vitamins and minerals. So vitamin E supplementation and selenium is very good. It's the most successful conservative treatment, so remember that, for those under 1 years old. So it's the most successful for those under 1 years old, and horses with neck pain and forelimb lameness because of, let's say, osteoarthritis, will benefit from intra-articular administration of these drugs I mentioned before, corticosteroids, sorry, those are glucocorticoids, or chondroprotective agents under ultrasound guidance. So I remember one of the chondroprotective ones was hyaluronic acid. You could do a surgery, so a dorsal laminectomy, so removing the lamina from the back, basically. Yeah, I don't know what this means, but memorize that. And it's performed by to decompress static lesions. There's also ventral stabilization using a threaded basket for compressive lesions, basically, because that's basically what wobbler syndrome is. And we're done with that.